Golden State Warriors are doing fantastic, aren't they? Why do you have that smug smile?
Yeah.
All right, I know. With Steph Curry out, we don't seem to do very well. I'm Doc Faisal, orthopedic surgeon with Move Smarter Health. We are sponsored by an educational grant from Kinesi Movement. I love sports. I love talking about injuries. I take care of shoulder and knee injuries, and I operate and treat on them. And please consider this an educational, informative video only. Here we go. So what we know is that Steph Curry's out because of his knee injury. It's been described as patellofemoral syndrome, runner's knee. We don't have a lot of detail on what's going on. We've all seen him on the court. He's got his white knee sleeve on his right knee, and you kind of feel him moving it around, touching it, aching. You see his expression, and there's something going on. Okay, so what exactly is happening? Now, again, I am providing information about musculoskeletal injuries within the context of athletes to provide a framework for education, but I'm not his treating surgeon, and I don't have any more information than you do that's available publicly. And so we're basically going to cover the topic of patellofemoral and anterior knee pain and the syndrome in general, and kind of relate it to what could be happening. But by no means is this a diagnostic, predictive AI system of algorithmic expression to prove what's going on. Pretty good use of words, eh? Yeah. So all I got to do is click a keyboard and people will think I'm real, but I'm actually AI. So the funniest is when you see AI bots, even like some of the videos with AI bots, they all talk like this. And their eyes blink really quickly. So you got to be careful because they've got people, like they've got so many people that look like various newscasters, but you can tell because all they do is this, and then they'll just do this, and their clothes don't move at all. And it's so obvious that it's AI. But anyway, so don't worry, I'm real. Cut that out. Okay.
That is staying.
That is staying. So what's anterior knee pain? All right, so we did destroy this knee. I kind of put it together, but it will fall apart. Ow. So anterior knee pain, we'll toss the meniscus out. We're not talking about the meniscus. That's right in the front. Okay, so you've got your patella, under surface. What's the patella made of? Cortical bone, some medullary bone, and cartilage. So the outer surface is cartilage. It's hyaline cartilage. That's the smooth articular cartilage, that glistening white surface lubricated with synovial fluid. And that articulates with the trochlea. The trochlea is the area in the anterior femoral condylar groove by which you have the gliding. Now, let's move this broken knee away and get to this. So then this one I haven't destroyed, so I'm going to try not to destroy it. But this is your normal mechanics of the knee. Now, keep in mind, this model is very limited. It's only showing quadriceps muscle. There's hamstrings muscles. There are calf muscles. You've got your medial and lateral gastroc muscles. You've got your soleus, your plantaris, and you've got collateral ligaments. You've got potential plica, capsule tissue. A lot of that can develop into thickening of the capsule. And any of the muscles going above, and oftentimes, for example, the quadriceps, one of the muscle components, well, not just one, but for example, the rectus femoris, that actually attaches to the pelvis above the hip joint. So when you have knee problems, you can't just focus on the knee. You have to look at the joint above and the joint below. Because why? Alabama, spot on. You were right. You can have Achilles, calf, leg, lower extremity, down to the ankle problems because, we just said it, gastroc,
all the muscles providing the calf, they start above the knee, not all of them. The major muscle groups start above the knee and continue down. So if you have one bone connected, you got the ankle, you got the knee, you got the hip, then you have the pelvis, then you have the spine. Everything is connected. It's just like kindergarten, right? One bone's connected to the next bone. When they're all connected like that, and you have these elastic connections, because muscles are elastic in a manner. You have tendons, you have ligaments, everything has an elasticity. And if we look at the muscles as not just contractile, and you just look at them as ropes or elastic bands, then if anything is tightened along that entire kinetic chain, you can have constriction. What happens when you have contraction? You get squeezing of the joint. What happens when you squeeze the joint and reduce the amount of joint space? It squeaks. It's harder to move if there's more pressure. Now, what can do that? If you get cartilage wear, you get compression, you get decreased joint space. But what if the muscles and the tendons are not loose and they're tight? If they're tight, they will constrict and they affect the entire knee kinematic paradigm. And that is what's often missing. The foot specialist focuses on the foot. The knee specialist focuses on the knee. The hip specialist focuses on the hip. You got to look at the entire kinematic chain. There are some great therapists, great surgeons, great doctors out there that talk about that entire kinematic chain, but you have to take that into account. You tweak your shoulder and your spine in tennis, that can go, the entire kinematic chain can affect you right down to your toes and ankle. Why? Because if you have an imbalance in your spinal alignment, that can lead to an imbalance in your hip, and overall pelvic balance, that can lead right down to your knee. So I know, Joey, let's get back to the knee. We're talking about Steph Curry, one of the most important players, if not the most important player at the Golden State Warriors, but one of the most important players in basketball. And we're talking about patellofemoral kinematics. So let's go back to this broken knee. What's going on here? So if you imagine that when you're playing high-level athletes, you can get impact, you can get side to side, tangential, diagonal, impact, anterior, posterior, shearing forces, compressive forces, distractive forces. Distractive forces may not be as bad, but if you have distraction and then sudden compression, then you can get an impact load between the bones, and that compresses the cartilage. And if you have shear, what can happen? What happens if you were to take like an ice skate, solid steel blade, and scratch across this glistening white fake surface? It'll tear it apart, right? So that's what you can get with chondral fibrillation, chondral fissuring. You can get areas of chondral loss. Sometimes it can actually result in a chondral fracture. In other cases, you can actually have something that may be unrelated to trauma, but could be from trauma, is avascular necrosis, osteochondral dissecans, and that's where you actually get part of the blood supply affected within the bone. Could be from bone stress, bone edema, is such a grab bag. Bone stress and bone edema is a grab bag for any possible thing you don't want to necessarily define by a specific medical diagnosis or injury, because one, you may not know, two, you only have an MR signal of increased fluid or a signal change, and three, you haven't actually looked inside to see whether there's any cartilage injury, or you don't want to necessarily say everything about what's going on. And all of those are possible. Now, if you have a cartilage disruption, that can affect how smooth this glides. If it affects the lubricity, the fluid architecture, and the fluid kinematics of the patellofemoral joint within the trochlea to slide, then that can certainly affect the overall movement. If it affects the overall movement, it can cause pain. Now, there are pain fibers everywhere. As far as we're aware, there's no pain fibers within the cartilage, but there are pain fibers within the bone that extend to the subchondral surface. So if you have associated pain, it could be from the capsule, it could be from the patellofemoral ligaments, it could be from the patellar tendon, it could be from from plica that may form. We've talked about plica before. Yes, you got it, Montana. There's only one Montana, right?
Is there a medical school in Montana?
I'm sure there is, because someone just said they know what they're talking about in Montana. So there must be a medical school or residency program in Montana. So anyway, so you know what the best part is sometimes? If there's actually someone in Montana responding or someone in Arkansas or Alabama, they're going to be like, how the heck did he figure that out? Whoa, can he see through the camera? Yes, I can. I can see right through you. I see you. Okay, so getting back to reality. Now, I can't read people's mind. I can't see you up in Montana. Don't worry. There's nothing happening. So if we look at the cartilage shearing phenomenon can happen. You get impact, you can get damage to cartilage. That can cause this fibrillation. You often, when we put a scope inside the knee, in the subarticular surface, in the patellofemoral space, for a lot of various athletes, some can be young, some can be old. Sometimes we see a knee that looks 10 years older than it should be given the patient's physiologic age, right? So you look in there and you can see chondral wear, chondral fissuring. You could see a portion of an old osteochondral fracture. OCD, you can see evidence of it, you can see demarcations, you can see basically when you probe it, you can also look at the softness of the cartilage. That's a very tactile, sort of subjective feel of the cartilage. Can you indent the cartilage, how soft it is? And then if there's a fissure, does the actual probe, it's a metal probe, 3 millimeters by 0.5 millimeters or less. It can vary depending on the probe that you use arthroscopically, smaller in the ankle or the wrist or the hand versus in the knee. And you have all sorts of various sizes, but then you could actually probe between fibers of cartilage, and then there's a fissure. And sometimes you can have loss of cartilage. And if you have loss of cartilage, that can certainly cause pain. And the pain can be not just from the impact in those areas where there's cartilage loss, but also in the catching that can happen because it's not as fluid. So your coefficient of friction is actually higher than it should be, and that can be affected by many reasons. You could have a lubricity issue. We know that when you get degenerative changes or cartilage changes, we know that the synovial fluid changes. So that can also affect the lubricity. That can affect the coefficient of friction. And it can certainly, and that's why we use various hyaluronates and other sort of devices, or, well, technically they're not a medication. They're actually intended as lubrication, so they're considered a medical device in that sense because it's actually a kinematic effect. There's a difference between how the European CE mark considers it and the FDA considers it, okay? So in any case, the fluid improves the overall lubrication just like oil would to help a rusty joint. Now, I'm not saying that any of these athletes, and certainly not Steph Curry, has a rusty joint. Don't kill me, Steph! But what happens is when you get the cartilage wear, you get the cartilage shearing, it affects the kinematics, can affect the overall kinematic balance, and then you catch the knee, or you twist a certain way and you don't have the full mobility. And that full mobility could be due to tightness across the patellofemoral joint, across the tibiofemoral joint. It could be a number of things affecting the rotation. You could have capsular thickening, plica. We've talked about all those various factors, but in the end, it comes down to lubricity, mobility, kinematic, overall balance of the entire knee from head to toe, right? Why did I do that little dance? Because it felt right. So, Patellofemoral syndrome is a very broad grab bag diagnosis. There could be many factors. It's an umbrella diagnosis. You have anterior knee pain, patellofemoral pain, all sorts of ways to treat it. You've seen people with straps, with knee sleeves, with donut sleeves. Usually the donut is if you have an instability, but more often than not, sometimes you can have anterior knee pain that's unexplained. For example, there was a high school soccer goaltender who had catching in the knee, and ultimately it was from a very subtle plica, little bit of thickening of the capsule on the patellofemoral area that affected how the knee moves and the overall patellofemoral kinematic balance, that affected how the mid-flexion jump when that athlete went to stop a soccer ball. Otherwise, she was perfect, okay? So there are many factors, and they can be subtle. You have to realize that any imaging we do is static for the most part. MRI, static. X-rays, static, two-dimensional. CT scans might be three-dimensional, but they're not showing articulation and mobility in real time. MRI is not in real time. So you're not seeing the mobility. And sometimes we'll do stress views, for example, of the shoulder, or even, it's harder to do in the knee because it requires bending and rotation and you're limited like that. But for the shoulder, sometimes you can put traction while they're going down, or you can put the arm up even while they're in the tube, unless they have major issues with claustrophobia, and even a large bore MRI intended for larger diameter individuals is limited in terms of the overall space. And so ultimately what it comes down to is you have a static imaging, you have a dynamic clinical exam, and then you have to come up with a diagnosis based on combining all the various facets of information and coming up with a clinical opinion and a diagnosis and then a treatment program. So as far as we know, he's not having surgery, Steph Curry. We know that he's got patellofemoral problems. We don't know the specifics. We haven't received any information about what his MRI or his radiographs look like, what kind of, is there actually trauma? Is there a cartilage injury? Is there damage? Is there bone edema? Has he had any treatment? What sort of problems are going on? Is he just doing physical therapy? Is it just mobility? Is it related to his hip or his ankle or his foot or his spine or anything to that effect? We don't know yet, okay? So for now, let's hope Steph Curry heals. He will be back. I hope. Oh, I'm still live? Oh, yeah, he'll be back. Please, please, please. See you next time.